Okay, so today we are presenting Miss S. She is a 46-year-old woman. She was diagnosed with stage 1 papillary thyroid carcinoma, given that she's under 55 years old. It was 1.6 centimeters, and she had 1 out of 12 lymph nodes involved with micrometastatic disease. Just going to scroll down quickly here to the therapy she had. She had surgery on January 7th, 2019 with a total thyroidectomy and right central neck lymph node dissection. She did not have any radioactive iodine ablation, given that her tumor was 1.6 centimeters and she had the 1 lymph node involved with micrometastatic disease. She did receive levothyroxine after the surgery for acquired hypothyroidism and was currently on, excuse me, this should be 125 micrograms. Okay, and then just kind of coming back up here, she presented to us in clinic 9 months after the time of her diagnosis, and we decided to present her today because she's a great example of a multidisciplinary review of fatigue. And it's a good point to mention that thyroid cancer patients also share the same survivorship concerns as other cancer diagnoses. And it's also a great example that we see the common theme oftentimes in our clinic that cancer may often be the least of their problems for any survivor. She did come in with her 2 primary concerns of how to adjust her diet now that she did not have a thyroid gland, and that bothered her greatly. And she also had absolute exhaustion or fatigue, and that also bothered her greatly. She came in on her distress thermometer at a 7 out of 10 after her first visit. She ended up at a 2 out of 10, finding that nutrition was the most helpful. And notably here, that matched her primary concern. At her second visit, she came in at a 6 out of 10, still having some financial distress, but her nutrition and exercise changes since the first visit had changed her life by increasing her energy levels, giving her better mental clarity, and improved her mood overall. And the second visit, she ended up after the visit with a distress of 2, finding that the physical therapy visit was the most helpful. For Miss S, she's single and she lives alone. She works as a DJ, though she took 8.5 months off for surgery. Returned to work part-time 1 week prior to the clinic visit. She did not smoke, did not drink any alcohol. Her activity level had been down, not getting 150 minutes of exercise each week or more. Pre-diagnosis weight, post-treatment weight, and current weight were stable, 147 for pre-diagnosis and post-treatment, 145 for current weight. She was not getting 5 or more fruits and vegetable servings each day. And she was taking vitamin D, 2,000 international units, once a day over the last month. She did have some other comorbidities, including, again, the acquired hypothyroidism. She had paroxysmal supraventricular tachycardia as well, and premature ventricular contractions as well. And she had no significant cancer-related family history. So I'm just going to come back to us here and stop the share so you can see us. And again, Jevin here, PA with the program. What was that?
No, it's just Kevin.
Oh yeah, that's just some technical questions. That's all.
Yeah.
I remember in the first visit that I saw Miss S, she came in and she had a lot of anxiety about her body image. She had this new scar after the thyroidectomy on her neck, and being in the public eye, she would try to hide it, having gone back to work with a lot of scars, and this gave her a lot of body image concerns. Not to mention, with the fatigue she was having, she struggled with her physical activity. At one point, she was very physically active and wasn't able to do so any longer, she felt, because of her fatigue. Coupling the physical fatigue that she was going through with her anxiety, she was also experiencing some emotional fatigue as well. So I think there was that dual component here of the fatigue that she was having. And so, again, addressing some of that with other members of our team was going to be critical for her on that visit. And so the other thing from the medical side of it is that she had just started on her levothyroxine at 125 micrograms and was still adjusting to that dose. It had been a short period of time, not even a full month. And I talked to her about how it took 4 to 6 weeks for that to affect her thyroid level on the lab work, as well as with symptomatic relief. And so that was something we discussed a lot during that visit, as well as some of the thyroid function tests she was following up on. By the second visit, as I mentioned before, she was feeling a lot better with the changes she had made, but she still had a lot of anxiety about some of the lab work. She came in that day specifically to talk to me about her thyroglobulin level, which was 0.2. We discussed that we really looked for that to be under 2, and she felt a lot better just having had that explanation. And I pulled that information from the NCCN, or National Comprehensive Cancer Network guidelines. And I advise her to follow up with her endocrinologist with any additional questions as well. She was actually noting some heart palpitations and some insomnia, along with increased anxiety. So we discussed the possibility that her levothyroxine dose, or thyroid hormone replacement, might also be a little high. And so that was something she was going to go back and discuss with her endocrinologist as well. All right, so I will pass it over to Angela to talk about her visit. Or
Well,
Maura?
I'll go next.
Yes, you can go next. Sure.
Before I start, does anyone have any questions or comments at this point about the case study? You can send it in on the chat room if you like. So from a nutrition standpoint, this was an interesting case because she was before her diagnosis, she was a practicing lacto-ovo vegetarian. And this thyroid cancer diagnosis really threw her. And a lot of it was her misunderstanding of what it meant to have her thyroid removed, and her misunderstanding of what it meant to have this replacement medication. She actually said to me, now that I don't have a thyroid, what foods can I not digest or tolerate? I was like, well, that's not how it works. And kind of explaining that process of the importance of the significance of this thyroid replacement hormone really left her whole. And she, that was a great relief to her. She really had that misunderstanding. So for a long time, she also did her own, Dr. Google search and came up with a lot of misinformation. And it turned out that a lot of the foods she came up with that in her search that she shouldn't have with her thyroid removed were mostly dairy products and nightshade vegetables. And this is kind of the mainstay of her typical diet. So she didn't know what to eat, and she ended up pretty much stop eating regularly, which contributed to her fatigue. And so she, so just that kind of re-education of just kind of getting back to her lacto-vegetarian practice, that it was a good practice to have, was very reassuring. The other thing she didn't understand was with the medication that you have to allow yourself 30 minutes with no food after you take your medication. That's not how she understood it. She somehow came away with it had to be like 4 hours. So she really struggled with when to take her medication and then not eating. So it was just a lot of confusion. So just straightening that out was, again, very reassuring. But all these ended up contributing to her fatigue. So as you saw in the report, that once she straightened that out and got back to her lacto-ovo practice, got the medication timing and a meal schedule back in place, she felt tremendously better. So I don't know if anyone out there has had that experience or has a comment about that before we go on. Again, you can send it in the chat room.
I can go ahead and I will unmute the room. and see if anyone has any comments or questions. Feel free to just jump in. Takes me a second while I'm going through here. All right, everyone is unmuted. If you have anything, feel free to jump in with any questions or maybe an experience you've had talking with someone about fatigue or nutrition related to fatigue. All right, so I don't think anyone has anything right now. Feel free again to chime in. I'm going to go ahead and mute everyone again, and we'll move along to Scott, who will talk about his visit with her.
Sure. So as Devin was talking about a few minutes ago, our patient, she had previously been exercising on a pretty regular basis prior to her diagnosis. And as happens so often with our patients that we see, once they have the cancer diagnosis, it kind of throws them out of their routine. And so it's hard for them to return back to the exercise routine, just like it was hard for her to return back to her eating routine. And she specifically told us at that first visit, she was actually nervous about exercising too much. You know, she falls into a category that we see a lot of people fall into, which is they don't know exactly what they're supposed to do physically after a cancer diagnosis. Are they supposed to exercise? Are they not supposed to exercise? How little is too little? How much is too much? That sort of thing. When I assessed her fatigue, the brief fatigue inventory, which I'll get to in a few minutes, she came out over a 7, which is clinically significant, clinically high fatigue. So it's a very, very high score. In addition to that, when I did my specific physical therapy screening for her, I also found that because of the surgery, because of the incision, she had limitations in her neck range of motion. And it was actually becoming a problem for her as far as driving, even just socially, like turning her head. She would actually have to turn her whole body if she wanted to talk to somebody, rather than just being able to rotate her head. So I think that also contributed to some of the anxiety that she was having on top of everything else. So specifically for her, you know, not only did I go over the American College of Sports Medicine exercise recommendations for her, but how to kind of reintegrate herself back to the gym, how to start off slow and kind of rebuild her endurance, and to give her permission to say, you don't have to go back to exactly where you were right now. You know, you can have a ramp-up process to kind of build your endurance, cardiovascular endurance, your muscular endurance to get back to where you were previously. In addition to that, I gave her a very specific home exercise program to work on that range of motion for her neck. So when she came back to us 3 months later at her follow-up visit, her neck rotation to the right had increased by 20 degrees. Her left rotation had increased by 25 degrees. So it was much easier now for her to drive and also to converse with friends if anybody was standing next to her or behind her. She had returned to the gym. Her fatigue was cut in half. It went from 7.3 to 3.56, so that was great. And at that second visit, I added even more exercises to the home exercise program that we had started previously. And she was a totally different person when we saw her that second time around. It was only 3 months after that first visit.
Wendy made a comment here about that, agreeing that many patients are hesitant to exercise until they get the green light. But they're often not told that. It often doesn't come up. And, we're fortunate that in Survivorship Clinic, we can give that permission. Yeah. But a lot of people come to us, never getting any instruction as to when, especially after surgery, when is it okay? So I think that's really lacking in the oncology team.
It is.
Yeah. I would agree with that. And I think we see a couple different scenarios. We get the scenario where nobody talks to them about returning to exercise, so they don't know when, if, or how they're supposed to return to exercise. Or sometimes the surgeon may say, oh yeah, you can go exercise now, go ahead. But they still don't know specifically what can they do, what can't they do, what limitations do they have based on where their incisions are, what muscles were affected by their surgery, and then coupling in chemotherapy or coupling in radiation therapy, hormone therapy, how somebody exercises may change following cancer treatments. So just simply being told, oh, you can go exercise now, it's not necessarily enough. They need a little bit more direction and really fine tuning as how to specifically exercise based on where they are at that point in their cancer trajectory.
Absolutely.
And I think what you just said, Scott, answers Holly's question, which is, do you write out a prescription to exercise? And you are very specific.
Yeah. So first of all, and getting ahead of myself, but I'll talk about it now. The new American College of Sports Medicine recommendations that just came out last month actually has almost like a flow chart for oncology providers to say, to ask those questions, to kind of cue them in, the provider into seeing, is this person exercising, yes or no? And if they don't have a whole lot of comorbidities, if they're doing pretty well overall physically, then they can probably move towards kind of a community-based exercise program, like going to a YMCA, that sort of thing. However, if that person is presenting with some more comorbidities, they are presenting with limitations in range of motion, if they have significant fatigue, if they have peripheral neuropathy, that should then trigger a referral to physical therapy or occupational therapy. And from that point, the rehab specialist is the one who does a full physical evaluation and will come up with a specific plan of care for that person.
Okay.
Great questions, great comments. Thanks, Wendy, and thanks, Holly. All right, Angela, if you want to talk about your visit.
Okay, so from the social work psychosocial perspective, some of the things that I spoke with her about is just overall her emotional well-being, depression, sadness, sleep, appearance, fear of cancer recurrence, fatigue, housing, and financial issues. And in the previous echo that we had, that was about fear of cancer recurrence. And you might recall that we discussed that there are some risk factors that can contribute to somebody's level of fear of recurrence. And this particular patient did have several of the risk factors, one of which, prior to her cancer diagnosis, she herself does have a history of anxiety and depression. And unfortunately, the other risk factor is that her fiance, who she had been living with, committed suicide unexpectedly in 2016, and she was diagnosed in 2018. So that alone was a pretty significant traumatic event for her, which then just compounded a lot of the things that played out throughout her cancer diagnosis and treatment, and also contribute to her levels of fatigue. She herself is in mental health counseling and was prior to seeing us. She sees a therapist twice a week and does take medication for anxiety and depression. And as Jevin pointed out, she was having, with regards to her appearance, again, the concerns related to her scar because she is in the public eye, but also changes to her voice. She felt like because of her thyroid surgery that her voice had changed. And I will tell you though, in talking to her, her voice did not sound strange to me, but I had just met her, but she was very self-conscious of that. The other thing is that she had just transitioned back to work part-time when we saw her for the first time in our clinic, and she was finding just only working part-time a couple hours a day, she was still quite fatigued with regards to that. So what her and I talked about is her slowly, building back up into working, slowly transitioning back to work. Her landlord at the time was threatening to kick her out and evict her because she hadn't been paying rent. And so she had talked to me about maybe she would work some plan out with him, like a payment plan or something, and see if he would be open to that. But because she was a single woman, she was responsible for all of her bills. She was having sleep issues. We talked about sleep hygiene. And then just again, listening to the recommendations of all the other team members to help her with her, significant levels of fatigue. And then in the last visit, when we last saw her, as everyone else has reported, she was doing much better and had been doing much better for about a month. And so it was so exciting to see that she listened to all of the recommendations of the team here, and she was in fact starting to feel better. She hadn't quite transitioned back to work full time. Again, still finding that she was still experiencing quite a big fatigue. Was able to work out a plan with her landlord to pay him as she could, but still having some sleep issues. Taking her 2 to 3 hours a night to fall back to get to sleep. And so again, just reiterating those sleep hygiene strategies and continuing to encourage her to go to mental health counseling.
And I'd like to add, if everyone's heard all this, this patient represents something that we've experienced in Survivorship clinic. Here's this woman who presents with a pretty straightforward thyroid cancer, didn't even require the radiation, radioactive iodine. And from a medical perspective, it was kind of pretty straightforward. She had a replacement hormone. Yet, as we are fond of saying, cancer was the least of her problems. As you can see how it played out in all facets of her life. Right. So even though the cancer seemed pretty, that it was dealt with and it was a pretty straightforward treatment, the impact it had on her life and how disruptive it was, and then it spilled out to employment, financial issues, and she was exhausted spiritually, emotionally, and physically.
Agreed. And I think Maura makes a great point that you can see how it's, the fatigue is addressed in each of the disciplines here. Something like sleep even can be related to her anxiety. It can also be related to her thyroid levels and how she's tolerating the levothyroxine. It can be related to not getting enough, exercise and her nutritional status. So these are all things that can factor in here. I want to take a moment and see if anyone had any other comments or questions about this case for Miss S. Again, I'll go ahead and unmute the room. I'm going to try something new here and unmute all. I know we have a few people here on too for chat.
Okay, let's get just go grab a wait. And I take off like 2 minutes.
Anybody have any questions or comments?
Hi, this is Holly. I just had a question. For somebody, especially it sounds like she was pretty particular in terms of what she was looking for in her diet. Do you guys have integrative therapy that you refer to? Like, would it be appropriate to see if acupuncture for the fatigue would have been something that she would have been interested in, or if there was do you find that there's a benefit to that?
Yeah, so great question, Holly. Basically asking if, and correct me if I'm wrong, if there's any integrative services that we have here, complementary services with integrated medicine, something like acupuncture. And we do. We actually work closely with them. One of the spaces we share is actually in part their space. And so we have an acupuncturist list for some licensed acupuncturists in the area. That we provide patients in their folder that they go home with. And we do recommend it for a number of different things, whether it's hot flashes, sometimes joint pain, and so on. Other integrative medicine services that are here, we have massage therapy that's here. There are things like art therapy and Reiki, and there are lots of options for the survivors that come through. A lot of times these are not paid for though. These are things that they would have to pay out of pocket for unless they're on active treatment. But we do refer them to these services as well. I don't know if anyone else had other comments on any of that.
Yeah, there's more and more emerging research on the use of the acupuncture for peripheral neuropathy. So again, we're very open-minded here. So we can make those referrals. There's more and more research coming out as far as yoga helping with fatigue, actually. So we try to offer some of those services here, but we also realize a lot of our patients will drive a fair distance just to get to our main hospital for their active treatments. So once they're done, it may be a little bit harder for them to come back to the main hospital where we're at. So that's why, as Jevin was saying, we try to vet different programs that are throughout the communities so that we know where to send them to.
And I might also add that, yoga, acupuncture, a lot of those services cost money and sometimes they're quite expensive. And this particular person was struggling to make her rent. So that she would have not been somebody who we could have referred to, say, acupuncture, because it's not necessarily covered by insurance. So I think taking that into account as well, when you're looking at the whole patient, thinking about, well, there might be these resources we can refer them to, but also keeping in mind that financially it might not be possible for them to afford this sort of service.
Holly, did that answer your question, or do you have any other follow-up thoughts about that?
No, it sure did. Thank you so much.
Thanks, Holly. Any other questions or comments about the case today? Or about any topics related to the case? Okay, so I think if there's nothing else, again, if there is that you didn't get a chance to say anything about, you can use the chat box as well. We're going to go ahead and get into our didactic presentation on fatigue. So bear with me a second. I'm going to share the screen with everyone. Full screen this. And I'm going to turn the floor over to Scott.
Okay.
To start today.
Great, thank you. So I think all of you got this PowerPoint ahead of time, so I'm not going to read the NCCN definition of cancer-related fatigue word by word. But a couple points to point out here is that cancer-related fatigue is unique in the sense that it is fatigue that is not proportional to exertion, and it's not relieved by rest. So the simple act of somebody trying to do the laundry following cancer treatment can be exhausting, and cancer-related fatigue can negatively affect something like that. And again, this is a kind of fatigue that taking a nap in the middle of the day is not necessarily going to make it go away. This is very specific to this population. It's the most often reported physical symptom of cancer survivors. Interestingly, just this past weekend at the conference of International Society of Geriatric Oncology, they were talking about cancer-related fatigue and how greater than 50% of older adults who are cancer survivors have moderate or high fatigue. So that's a pretty high number, and that's pretty significant fatigue for that population. So it's a very, very common thing that we see in our survivors. And so the question is, what exactly causes cancer-related fatigue? And truly, it's kind of the perfect storm of all of the treatments that we see with our survivors. The combination of chemotherapy, radiation, and surgery, as well as some of the other options that are out there for treatment. Specifically, we can think about something called this multiple hit hypothesis, where our pulmonary system can be affected by systemic therapy as well as radiation therapy. Our cardiac function can be negatively affected by doxorubicin, as well as Herceptin, and as well as radiation therapy. Our vascular system, our blood vessels, can also be negatively affected by doxorubicin and radiation, and the skeletal muscles can negatively be affected by hormone therapy and by chemotherapy as well. So if you put that all together, what we're seeing is actually a decrease in our cardiovascular reserve, and so that's one of the prevailing theories of what cancer-related fatigue is and why a survivor suffers from it. So, obviously, if somebody is fatigued, it's going to impact their physical function. And again, not even just the ability to go to the gym to exercise, but in completing simple activities of daily living, like doing the laundry, like taking the dog for a walk, or being able to play with your grandkids. And you can better believe that if you're having a tough time even completing these simple things, that it can negatively affect your mood, which can lead to depression. Cancer-related fatigue can also impact somebody's work performance if they're really tired and they just want to get back to work to some sort of normalcy. They're going to have a difficulty with that as well. And there's also, you can also see where cancer-related fatigue can impact a person socially. If you're tired, you're not going to be able to go out for coffee with your friends, or you're not going to be able to go out for happy hour on Friday night with your coworkers because you're so tired. And there is some correlation as well with cancer-related fatigue and cognitive performance as well. So it really affects the whole person in all avenues of life. So how do we assess cancer-related fatigue? There's a couple of subjective questionnaires that are out there. The one that we use here at our survivorship clinic is the Brief Fatigue Inventory, which was developed by MD Anderson. It's nice because it's quick and easy. It's 9 questions, and we ask our survivors to rate the fatigue on a scale of 0 to 10, and then we average out the score. So again, an average score of 4 to 6 is considered moderate fatigue, and anything that's 7 or higher is considered high fatigue. If you don't have access to the Brief Fatigue Inventory, just doing a simple 10-point rating scale. On a scale of 1 to 10, what's your fatigue type of thing. I can't tell you, in the world of physical therapy, the Academy of Oncologic Physical Therapy is actually currently revising the clinical practice guidelines on cancer-related fatigue. That's in review for publication right now, and so we expect in 2020 to have some of these updated CPGs that we can get out to all the providers. And I think it's important for any oncology provider, to be asking these questions, to be asking our survivors, how are you feeling? And I think it should be part of the assessment. Just like taking blood pressure or taking blood values, we should be assessing what is our patient's energy level. How are they exercising? And if not, why aren't they exercising? So the big question is, how do we break this negative cycle of fatigue? We try to break it through exercise. And you'll see that posted right now are the ACSM, or American College of Sports Medicine, recommendations that were first developed in 2010 by this roundtable group. And at that point, they really did take recommendations for exercise for the general public and try to just apply it to the cancer survivor population by saying they want our survivors to try to exercise 150 minutes a week of some sort of cardiovascular exercise, as well as to do strength training twice a week. But the newer recommendations that just came out last month get a little bit more specific, which is great, so that we can really kind of hone in on that. And one of the really exciting things that these updated recommendations from the American College of Sports Medicine, and part of that roundtable with the American Cancer Society, with ASCO, with the American Physical Therapy Association, they did a really comprehensive review of all the randomized clinical trials over the past 10 years, and we can now definitively show with strong evidence that that exercise helps decrease fatigue, as well as decreases anxiety and depression caused by cancer, and it helps improve the quality of life of our survivors. So now we have a lot more research on that to prove that exercise helps reduce fatigue. And it was really interesting, with these new recommendations that came out, how they can really break it down as to what are the benefits of aerobic exercise, what's the benefit of just doing resistance exercise, and then the combination of the two. And what they found, at least specifically for fatigue, is that really any kind of activity, whether it is aerobic exercise or if it's just strength training, those alone will help reduce fatigue. But if you're able to combine them together, that is even more effective in reducing fatigue. I think I've talked about this previously, but I think it bears repeating. When we get a patient in front of us, we tell them, we want them to exercise 150 minutes a week, and their eyes get really big, and they say, "You want me to do what?" I think that to take a minute or two and try to talk with them about how are they going to do that. And if they're still struggling past this point, then I think that helps generate a referral to a rehab specialist. But even in your setting, you could talk to them about tracking their exercise. I mean, I think most of us around this table right now are have some sort of wearable activity monitors. So that's always a good way to see how you're doing as far as the number of steps you're getting and how much active minutes you're getting per day. Being able to exercise with a friend or a coworker. If you make plans to meet somebody at the trail at 8 a.m. on Saturday, you better show up, because by 8:05 you will get an angry text saying, "I'm here, where are you?" I'm a big proponent of setting goals, and regardless of what that is, whether it's signing up for a 5K, signing up for a benefit bike ride, planning an active vacation, if you plug down your registration fee, or if you plan it and you put down your deposit for that, then you're committed. And that helps with accountability for exercise. And I also tell people to plan ahead when it comes to trying to exercise. My team will tell you that I am infamous for going out on my lunch break and changing and going for a run and coming back and changing again and seeing patients in the afternoon, because that may be the only time of the day that I get to exercise. So, to be able to have your patients look at their week ahead and say, when can I fit this into my schedule? And to realize that, something is better than nothing.
Thanks, Scott. Jevin here. Just going to talk a little bit about how I would assess for fatigue during a visit as well. So there are a number of things that I'm considering when someone presents with some level of fatigue. One of the first things I think about is what previous treatment have they received, and how long has it been since they've been on that treatment. As Scott mentioned before, there are a number of things that can lead to fatigue as far as treatment goes, whether it's chemotherapy, radiation therapy. For the patients, I see in Survivorship who have had stem cell transplants, and the surgery in and of itself, if they've had a surgery. And then how long has it been since that point in time? So for something like chemotherapy, for example, we can see that last for up to a year or even more after treatment. Although it's, important to be mindful about talking with survivors about that information as well, so they're not getting anxious saying, well, it's been a year, why have I not gotten any better? And then also considering the long-term effects from the therapies themselves and how that might be affecting them, as Scott mentioned before too, things like cardiotoxicity or pulmonary toxicity. If they have any physical limitations as a result, that might be limiting their physical activity. And then it's important to always ask the important questions. How are they being limited by their fatigue on a daily basis? Are they able to sleep? And could that be something contributing to their fatigue as well? And then lastly, always being mindful of, is this purely physical fatigue, or is there an emotional component to it? And being able to get an idea of where they're at and meet them with their individual needs. Of course, Scott mentioned the fatigue scale. That can be something that can be used as well. And for some things I would counsel on, could include setting priorities or conserving energy, finding out what a survivor is able to do on a daily basis, and discussing with them ways to approach their day-to-day. And then, of course, keeping in mind the team that you have available at your disposal. Using the multidisciplinary approach, whether it's from a nutritional standpoint, exercise, psychosocial interventions, or other complementary therapies. Oops, skipped ahead. And then also it's important to consider alternative causes of fatigue as well, besides just cancer-related fatigue and treatment-related fatigue. Comorbidities can be a cause for fatigue as well, with a number of possibilities. Whether it's thyroid disease, for example, in that case we saw today, granted that was from her surgery, cardiovascular disease, pulmonary disorders, adrenal disorders, or if they've had any chronic steroid use, mental health concerns, sleep disorders, if they need a referral to sleep medicine, or physical limitations, and poor hydration. And of course, keeping in mind the diagnostics that go along with that, whether it's complete blood count, looking for anemia, electrolytes, thyroid function testing, cortisol for adrenal disease, or a sleep study, if they have something like narcolepsy or sleep apnea or sleep-related concerns. Consider medications as well. There are a number of medications that can lead to fatigue and drowsiness, such as a lot of the antidepressants like SSRIs, sometimes antiemetics as well. Other things like opioids and benzodiazepines for anxiety. These are all things to be considering. And there are other alternatives, for example, with antidepressants like bupropion or SNRIs that can be less sedating. And then, of course, considering if they have any other signs or symptoms of metastatic disease that could be contributing to cancer-related fatigue, and working that up appropriately.
Okay, so we're just going to look at the nutrition aspect of it. Some of this I've already covered in this case study. I think when someone comes in complaining of fatigue, I really look at meal timing. And really the goal is to stabilize blood glucose levels. And oftentimes we find that the meal timing is kind of out of whack, as we saw in this case study. I also find it effective to talk about creating an overnight fast of at least minimum 12 hours to 16 hours. And that kind of helps people straighten out their meal timing. Oftentimes fatigue, people underfuel during the day, and then they tend to take in the majority of their calories in the evening. And this kind of helps, again, redistribute those calories to earlier in the day. I do look at macronutrient fuel mix. I'm a big believer in fueling the body in the manner in which it's meant to be fueled, and not to create a metabolic stress on the body. So this is pretty straightforward distribution of macronutrients, my anti-keto stance. Which is like the hot topic of most of people coming in thinking they should be eating keto. So yeah, I kind of tackled that. Also, when you do adjust the macronutrient fuel and increase the complex carbohydrates, you're effectively increasing fiber, which helps stabilize blood glucose level, and you're decreasing added sugars. I do cap it about 30 grams a day, especially to look at their added sugars in the liquids that they're drinking. Again, with the goal of stabilizing blood glucose levels. Also, when there's a lot of fatigue, there's not a lot of energy to prepare food, to food shop. So you look for easy, simple foods that are nutrient dense, so that they get a lot of bang for their buck in terms of their effort. Just saw someone this morning where that was the case, where I had to map out small frequent feedings in very simple to prepare foods, just to kind of get her back on track. And I just want to say before I leave that you can gather from hanging out with Scott that nobody has an excuse not to exercise. That you spend the day with Scott, and he comes in, I just came from a run, or I just went for a bike ride, and it's like, oh, I better just stop sitting.
Sorry.
But he's a great inspiration.
And I think that's a powerful point, Maura, just to go off of that. Stop sitting. Like, if someone is limited already in what they do on a daily basis, it can be as simple as doing sit-to-stands, getting up and moving. If they're sitting all day at a desk, having a standing desk available to them. So I think that's powerful in and of itself.
Okay, so my turn. This is Angela. Do you want to? Oh, okay.
I thought you were asking for it, sorry.
That's okay. Okay, so when I'm meeting with patients in our clinic, one of the things that I talked to them about is that cancer-related fatigue. There's physical as well as emotional aspects to that related to cancer and cancer treatment. And as we heard from all of us, as well as from the case study, that cancer-related fatigue really has a negative impact on work, relationships, mood, daily activities, overall just quality of life. Fatigue is not only a symptom of cancer and cancer treatment, but also a symptom of depression, anxiety, and stress. So when I'm meeting with patients, one of the things that I'm keeping in mind as I'm assessing them is this cancer-related fatigue solely because of cancer and cancer treatment, or is there a psychosocial component here that's related to depression and anxiety, even PTSD, or is it a combination of both? And quite often, it can be a combination of both. And so again, helping the patients understand that this is normal, how they're thinking and how they're feeling, and that a number of cancer survivors also think and feel the way that they do. With sleep disturbances, they're correlated with fatigue, but also, as Scott pointed out, fatigue can persist even when a patient reports adequate sleep. Oh, thank you. Sorry, go ahead. Go ahead, Gary. All right, sorry, I was supposed to click and he clicked anyway. Again, there are some risk factors to keep in mind with cancer-related fatigue. And as our case study, we pointed out, she had a history of mental illness, depression and anxiety prior to her cancer diagnosis, obviously sleep disturbances prior to and during treatment, physical inactivity. A patient's just sort of, their self-talk. Do they have negative self-statements that are catastrophizing related to fatigue and the experiences that they had? So just even their mindset being negative in nature can actually create some cancer-related fatigue. Exposure to childhood stress, including abuse, neglect, trauma, and also if it's an older adult, loneliness can particularly lead to experiencing cancer-related fatigue. And then you've seen this slide before, but really as I'm meeting with patients, identifying, again, if they are experiencing some anxiety or some depression, significant levels of fear of cancer recurrence that are contributing to their cancer-related fatigue, I would, of course, encourage them to seek medical counseling, psychiatry, go to support groups, sleep hygiene, and again, just the cognitive behavioral interventions about how our thoughts and feelings are connected to our behaviors and the choices that we make. And lastly, just learning such strategies as mindfulness, meditation, yoga, acupuncture, deep breathing, guided imagery, all of those things can help with just overall well-being and improve fatigue as well. Oh, we're done.
We're done. All right. Thank you, everyone, for all the attention today. I wanted to open the floor for any questions. I'm going to go ahead and stop sharing the screen right now.
Yeah, in the
looks like
chat
we had
room,
a few-
I was trying to type an answer. I'm not a very fast typist, obviously. So there was a nutrition question about 16 hours for the fasting, overnight fasting. It sounds like intermittent fasting. It's not intermittent fasting. That's, again, another kind of hot trend. I'm talking about an overnight fast and having an early stop to eating in the evening, and then creating a minimum 12-hour overnight fast to the next meal, the first meal of your day, the next day, which is your break fast, breakfast. That's how it was named. And so that it gives an overnight rest to your digestive tract, particularly your pancreas, particularly to preserve insulin. And so there are lots of benefits to that. There is some recent literature to support even extending that overnight fast, 16 hours, but I find that's often hard to do given people's work schedules.
It's a good question. Anybody else have any questions? I'm going to open the floor up to everyone, unmute everyone here. Feel free to try. Oh. Go ahead. All right. Sorry about that. We got some reverberation. If anyone has any questions, feel free to jump in. Or again, the chat box. Has anyone ever had any experience with counseling someone on fatigue, a cancer survivor on fatigue, and can share a little bit about that experience and maybe a story they've had? Okay. Any other thoughts from anyone here before wrapping up a little bit? Okay, so one more thing I did want to ask everyone here today. As I mentioned in the beginning, we're through 4 sessions now, and we have 2 left. Little flexibility with the last session. I did want to get an idea of any topics that any one of you would like to see addressed that maybe hasn't been addressed. Something that you were hoping to hear in another session that you didn't hear enough about or didn't hear about at all. Anything at all related to cancer survivorship. And again, I think everyone is unmuted. Feel free to enter in the chat. If you can't think of anything now and you think of something right after we end this meeting today, you're like, darn it, thought of it just now, just go ahead and email. Happy to take that too. Or include it even better in the post-session survey.
The next exciting topic is going to be energy balance, which is really the way we're going to address weight management and take a lifestyle intervention approach. So there'll be a lot of great information on that for the next session.
Yes, and that session will be in 2 weeks, and that'll be on December 4th, I believe, if I have the date correct there. Wednesday, December 4th, same bat time, same bat channel. It'll be 2 to 3 in the afternoon Eastern time. Anything coming up in the chat? Do we have? Okay. Oh, it looks like, I think Sarah had a comment from UConn, maybe discussing more in depth how our clinic was created and has grown over time, some of the challenges and things that we've had to work on, or things that work, excuse me, for us. Yeah, I think that's something we can flesh out a little bit more. Looks like we're running just about low on time here, so I don't know if we can get to all that today, but I think if we can include a little smorgasbord of extra topics in the last session, we should do that. So thank you, Sarah. That's great feedback.
Was there another question, Kevin, if you want to address this?
No, I think that was what we had before.
Okay.
Yep. So I think we're good for today's session. Thank you everyone for joining us today. Again, all of this is going to be posted up on box.com. If you didn't receive that link, let me know at the survivorship@yale.edu email. Please remember to fill out the post-session survey. And until next time, we'll see you then and talk about energy balance, nutrition, exercise, and weight management. Thanks, everyone.
And happy Thanksgiving.
And happy Thanksgiving. Thank you.
Thank you.